We did a retrospective study using Optum's insurance data on a national level in the US in patients who had cancer and stroke. So we found about 86,000 patients with a stroke, and about 10% of them had cancer, active cancer at the time of their stroke. And although the risk of recurrent thromboembolic event at 6 months was very high in this patient, it was 38 per 100 person years, and over two-thirds of them were due to ischemic stroke. Only 15% of them were prescribed anticoagulants, which is pretty low comparing the data of patients who had cancer and DVT. About half of these patients are prescribing anticoagulants, but it's not the same for stroke. Although the risk of major bleeding, which is what physicians are the most scared of, is kind of comparable between the groups. In our cohort, it was 21 per person per 100 person years, and it was kind of similar to the DVT literature. And we also investigate the association between anticoagulant use and risk of recurrent thromboembolic events. And in our cohort, anticoagulant did not decrease the risk of recurrent thromboembolic events and did not increase the risk of bleeding as well. But our results, given the retrospective nature of the study, could be confounded by indication. Patients who had more severe cancer, metastatic cancer, or more embolic type of stroke may be more likely to receive anticoagulants per their physician's opinion. And we need randomized clinical trial data to be able to answer this question, this clinically important question.